Namaskaram and good evening to all of you. As you can see, I am not Vaidya, I am Prasad. He is the director of our institution, Sunetri Ayurveda Ashram and Research Center. I am Uma, the research and administrative counsel there. I am not an Ayurvedic doctor, I am a computational biologist trained at Stanford University, and I am working with him for some research protocols. So I will be speaking on his behalf. I'm going to talk about SUPRA. SUPRA stands for Sunetri Protocol for Autism, a novel approach to treat autism. A brief background. Autism spectrum disorder is a neurodevelopmental disorder that manifests usually before the age of 3, and it's characterized by lacking social interactions and affected communications skills, and less frequently noted in modern medical literature are the toxin load, a compromised digestive system, and frequent infections. The last 3 are usually not mentioned as highlights in modern medicine literature, but I would like to point it out here. Now, with the CDC reporting an average incidence of 1 in 110 children being affected with some form or the other of ASD, it has become like an urgent public health concern. Similar statistics are being reported from Europe, several countries in Europe and elsewhere. The causes of autism are still not very clear. It's probably environmental toxins. There have been several studies made on the genetics of autism. So we hear about some kind of gene or a combination of genes on chromosome 4 or 13. There is no particular Mendelian inheritance seen in autism. There is no single gene or single chromosome association. So we are still not very clear on the genetics. Modern lifestyle is touted as a reason. We are still not very clear. The pathophysiology is not very well understood. Among current autism treatment strategies or maybe management strategies, since there is no known cure, we just know that early intervention is helpful. So behavioral therapy is one of the modes that is used for the management. Sensory integration techniques. There are certain other new fads like vitamin therapy and hyperbaric oxygen. Now, we have seen that in 100% of the children that come to our clinic, diet plays a very important role in the behavioral patterns of the children. And of course, their allergies and food sensitivities. So diet does play a very important role. Now, coming to the role of Ayurveda. The word autism does not appear in the classical Ayurvedic text. So how do we go about designing a treatment or management mode for this condition? So if we first set ourselves to the task of learning this and trying to explain the condition from the perspective of Ayurveda, sitting within the framework of Ayurveda, what is happening in the children that come to us for this treatment. Now, we see that in all of these kids, there is a compromised or a non-operational Agni. This is what leads to the toxin load in their systems, the frequent infections, their food sensitivities, clogged channels, which are called shrotas, resulting in physiological disturbances. Their dhatus are polluted, which shows up in tissue level problems. And this in turn affects their response to the external environment. Now all this leads to an improperly functioning ojas, which results in the entire spectrum of symptoms in these disorders, including poor immunity and infections, their phobias, their inability to talk to peers, their deprived social interaction skills, and so on. We like to represent the connection of Agni, Srotas, Dhatu, and Ojas with this schematic. This is the Samprapti of the disorder. Agni is responsible for the proper maintenance or functioning of the Srotas. If Agni is weakened or malfunctioning, external and internal toxins cannot be flushed out of the system. These in turn build up in the Srotas, any kind of channels, anatomical or physiological. So there is a toxin load in the Srotas. Now, independently, Agni also has a direct say in the formation and the transformation of the dhatus. And the end dhatu, or the most progressed or refined dhatu, is ojas. So if the formation and transformation of the dhatus is affected, naturally the ojas is going to be deprived. Same goes for the srotas. The weakened or malfunctioning channels are going to lead to a deprived ojas. So we see that in 100% of the children coming to our clinic, this is what is happening in their the background of ASD kids. Now, we have had 8 years of experience treating children with ASD, and based on the principles of the Agni, Srotas, Dhatu, Ojas networking, which we just saw in the previous slide, we have formulated a 3-phased approach to deal with managing ASD kids. Now, this approach helps the physician to frame an interventional approach with confidence and precision. And most importantly, it offers the scope to offer personalized treatment, which indeed is the hallmark of any Ayurvedic treatment. So I'm not going to talk to you about specific medication or particular treatment modes or modalities. I'm going to give you an overview of what these 3 phases are. So any clinician can look at these and adapt it for each child. Each child is unique, so no one thing is going to work for every kid. And being a spectrum of disorders, ASD is not just one uniform kind of condition. Children can show varying symptoms from very severe to very minor. Some can be high functioning. So it indeed is a spectrum. So the name ASD is good. I mean, in that way, it represents the spectrum of conditions that these children present. Now, the 3 phases of Supra are, the first phase is Agni Deepanam. As we saw in the previous networking slide, one of the most important and crucial things that is getting affected in these kids is their Agni. So first we target the Agni of the child. Agni Deepanam is the first phase. That resolves a whole lot of problems associated with the digestive system and helps with the nourishment of the dhatus, which we are going to do next, which is Dhatu Shodhanam. The next, after the tissues are rejuvenated and the Agni is set right, the path becomes clearer for the next step of taking care of the Ojas. That phase is Ojaskaram combined with Medhyam. Going to the first phase, that of Agni Deepanam, medication and dietary suggestions are given which will scavenge the toxins from the GI tract, clear up the channels and aid the nutrition of the dhatus, which is going to be the second step. So in the Dhatu Shuddhi phase, where we want to cleanse the tissues, we make use of the full potential of Anta Parimarjana and Bahi Parimarjana. So there is internal medication and external therapeutic processes applied here. And once we are very sure that these 2 processes have gone into completion perfectly, we move on to the next phase of Ojas Uttajanam, where a combination of Ojaskara and Medhya medication is provided to channelize the physical and mental activities of the individual. Now, once this 3rd phase is completed to perfection, we can be pretty sure that the child will perform well in familial and social situations, as we have seen in our clinical experience. Now, what are the results of each phase? In the first phase, we see a significant change in the digestive health of the child. The gut status improves, aggression and hyperactivity are reduced dramatically, and there is a significant reduction in infections, causing less trips to the hospital for antibiotic therapy. The second phase, the sleep of the child improves. There is a gain of muscle tone. These kids usually come with very reduced muscle tone. Gain of muscle tone, reduced hyperacusis, and compulsive, repetitive, obsessive behaviors get normalized. There is a greater receptivity to commands or suggestion from parents, teachers, etc. And they are able to make eye contact, which the parents kind of find totally fascinating. Now, the 3rd phase is Ojaskaram and Medhyam. Here is when the child is actually able to speak. They start speaking in a normal pitch and voice. Sometimes these kids have a tendency to kind of speak in a very high-pitched voice. Even if the sound is inside them, they don't tend to do that. Now, when this phase is over, there is definitely more vocalization, speech, verbalization. a greater interest in socializing and in peer interaction. They tend to play and associate more with kids of their age, and a definite overall improvement in academic and other skills, as evident from school reports. Now, to conclude, Ayurveda provides an ideal framework to manage autism, and it's very good for smaller children with milder symptoms. And we suggest that we should encourage a multi-pronged approach. Let the parents get all the treatments that they want their child to undergo, and use of high quality medication, which I must stress, ensure the purity of medication, the application of the classical principles in a diligent and logical manner, and of course to inform the parents in detail about the course of action. And most importantly, use personalized treatment. This offers ample scope for that. Now, to conclude, thank you for your attention. And this work was made possible by Dr. Prasad's incessant contributions and work in the past 8 years treating autistic kids. And I must say that this novel protocol has been very successful clinically. We have helped over 150 families manage one or more autistic kids in their house pretty well, and they keep coming back to our clinic, and it has been a big success clinically. So this is what I would like to say and conclude. If I have any questions, I can take them now. Thank you.